Hannah is a 28-year-old female who suffered a car accident. Before the accident, she was a fourth grade teacher who enjoys reading and spending time with her fiance, Mark, who is also a teacher. Hannah was recently admitted to the Baylor Medical Center due to an MVA causing distal humeral fracture and minor incisions in her neck region. An ORIF was performed to fix the displacement, and sutures were performed to close the incision up as well. It was also reported that she had a history of glaucoma in her eyes, giving reason as to why she didn't see the car coming from the accident. After the surgery was done, the primary care physician decided to check in to see how Miss Logan was doing. After spending some time with her, the doctor noticed that Hannah's been experiencing some abnormal symptoms. Hannah had been experiencing some frequent memory loss, some aggression, and a difficulty with appropriate behavior. Tests were given, and tests indicated that Hannah had also experienced TBI Rancho's level 4. Hannah is also showing present signs of alertness, but initiating tests independently has been a challenge for her. Hannah often would get agitated when instructors would give her certain tasks to do due to her difficulty with initiating movements. Hannah is currently in an inpatient healthcare facility and is now being referred to an occupational therapist to work on self-care and dressing techniques, along with strategies to improve her memory and her vision. So from my complex client, the three diagnoses that we can see here are the distal humeral fracture, the TBI, and the glaucoma. And along with that comes with the symptoms. The symptoms for the distal humeral fracture include swelling, bruising, stiffness, and tenderness to the touch, while the TBI includes decreased balance, cognitive issues, slurred speech, and decreased sleep as well. While the glaucoma, you'll experience eye pain, headaches, blurred vision, and peripheral vision loss. The two models that drove me into the decision-making of the intervention process was the biomechanical frame of reference and the rehabilitative frame of reference. So the rehabilitative frame of reference was chosen as its primary role is to make each client as independent as possible, regardless of the client's current level of function. This frame of reference uses various interventions, approaches such as adapting and modifying the occupation to increase the independence, the occupational independence. This frame of reference also promotes the utilization of assistive devices and environmental modification to enhance function. So for the TBI and the glaucoma, this frame of reference will help guide intervention for adaptive equipment to enhance and improve occupational performance, such as feeding and self-care. While the biomechanical frame of reference will be adequate when it comes to treating Hannah's distal radius fracture, as it seeks to maintain and restore the client's functional movements that have been impaired. So for the evaluation process of the complex client, it'll be based on the needs and the deficits that the client displays based off their occupational performance. Evaluation will consist of understanding more about the client's current injury status, past medical history, and functional capabilities. The evaluation process will also conduct information regarding the client's interests, values, and needs, along with a general idea of what the client's schedule looks like and how they want to determine treatment. And regarding the screening process, various assessments will be taken. The assessments that I have chosen are the timed up and go, the mini mental, a range of motion test, and a Snellen chart to test her vision. Such screenings will be done to assess her physical, visual, and cognitive abilities. Interventions that will be used to address the occupational performance deficits of the client will be dressing tasks along with memory and visual scanning activities. Dressing tasks that incorporate moving, such as going to the closet to picking up clothes, is a great intervention to help practice initiating different types of movements. Expected outcomes from this intervention will be an increased independence with dressing tasks. Memory activities such as card matching will be an intervention used to improve the client's memory and increase leisure engagement while she's recovering from. Expected outcomes from this intervention will be improved cognition and memory needed for various occupations such as health management and management of financial needs. Visual scanning activities is another intervention that will be used. Activities such as I Spy will be incorporated to help maintain visual skills. Expected outcomes will be improvement in visual skills for various occupations. One policy issue that can impact the client is the typical length of stay in an inpatient rehab facility. Typically, clients are only held in a rehabilitative facility for 20 days. This can negatively impact the complex client if the client still needs more time to recover. While understanding the complex client gives us a good insight of how to provide adequate services for this particular case, we must not forget to address the population-based needs of the individual who have experienced similar stories to the one of the complex client. An evaluation strategy that can be used to gain information at the population level is to provide structured interviews to determine generally the main needs and concerns of the clients within this population. Once the main areas of need are identified, then it can become easier to create appropriate interventions needed to fix the problem. An intervention tool that can be utilized to address at the population level is providing individuals with adequate education about healthcare disciplines, such as occupational therapists, that are available for those who experience similar cases. Providing the population with information about what resources are out there, along with how the health discipline can help, will allow them to make appropriate decisions on how they would want to turn to the functional independence.